Right now, someone is sitting at their desk. They feel fine, maybe tired, maybe stressed about a meeting later. Normal day. And inside their chest, their heart is sending a message. Not a dramatic one, not a collapse. Just a small signal that something isn't working right anymore. Most people don't notice, some do. And most of those who notice ignore it anyway. That's the real tragedy of heart disease. It's not the sudden part. It's the part where your body tries to tell you for months and you convince yourself it's nothing. This year, 17 million people will have cardiovascular events. Most of them will say, looking back, I had signs, I just didn't realize what they were. This video exists to change that. By the end, you won't just know what those signs look like, you'll understand what's actually happening inside your body when they appear. And more importantly, you'll know exactly what to do about it. Let me start with what almost nobody understands about heart attacks. People think a heart attack is sudden. They think it's chaos, like a switch flipping from healthy to dead in seconds. That's the Hollywood version. The real version is different. The real version is a story that starts years before the actual event, a story written in the walls of your arteries. And if you know how to read the early chapters, you can stop the story before it reaches the ending. Here's how the story actually begins. Inside your arteries right now, microscopic damage is happening. You can't see it, you don't feel it, but it's there. Every time your blood pressure spikes, every time you're under stress and your cortisol floods your system, every time inflammation builds somewhere in your body, every time you eat something that sends your blood sugar spiking, that damage happens. Small tears in the innermost layer of the artery wall, nothing catastrophic, just micro injuries. And here's where the problem starts. Your body thinks these injuries are wounds, so it sends help. It sends molecules to patch things up. It sends inflammation to clean the area. It sends cholesterol to try to heal. But healing doesn't work the same way in your arteries as it does on your skin. In your arteries, this healing response creates buildup, plaque, a hardened mass of cholesterol, calcium, and inflammatory cells that grows slowly, year after year, silently narrowing the space where blood flows. This process is called atherosclerosis, and it's happening in millions of people right now. They're walking around, working, exercising, feeling completely fine. Meanwhile, the tubes that feed their heart are getting tighter and tighter. The body adapts at first. It increases blood pressure to push harder. It increases heart rate to compensate. These changes feel like nothing. You might notice you're a bit more tired. You brush it off. The narrowing continues. Until one day, one of two things happens. Either the plaque itself becomes so thick it completely blocks the artery, or, more commonly, the plaque ruptures. A crack forms in its surface. Exposed to the blood flowing past, it triggers an emergency response. Your blood clots. It tries to seal the rupture. And that clot is exactly the wrong place, at exactly the wrong time. It plugs the artery completely. Blood stops. Oxygen stops. And the muscle tissue of your heart, starved of oxygen, begins to die. That's a heart attack. But here's what you need to understand. That rupture didn't come out of nowhere. That artery didn't decide to close overnight. Everything that happened was a natural endpoint to a long process. And somewhere along that process, almost always, your body tried to warn you. Most people just didn't know what to listen for. There are 5 distinct things your body does before a major cardiac event. Some people get all 5. Some get just one, repeatedly. Some get a combination and convince themselves it means nothing. The danger isn't in individual symptoms. The danger is in ignoring the pattern. When your body is trying to tell you something important, it doesn't use one sentence. It repeats itself. It finds different ways to say the same thing. You're walking upstairs, or you're carrying groceries, or you're walking faster than usual. And somewhere in the middle of your chest, maybe slightly to the left, something feels off. Not exactly pain. That's the word people get stuck on. They think, it doesn't hurt, so it's not serious. But that's not how the heart communicates. What you might feel is heaviness, like someone is standing on your chest, or tightness, like something is squeezing from inside. Or sometimes it's less dramatic than that, just a sense of pressure, of effort required, of something not being smooth anymore. And here's the crucial part. It comes when you exert yourself. You're doing something, your heart is working harder, it needs more blood, and that's when the message arrives. Then you stop, you rest, you sit down. And within minutes, it's completely gone. You feel normal again. So you think, probably muscle pain, probably anxiety, probably something I ate. But here's what's actually happening inside your body. That narrowed artery fed by plaque buildup wasn't able to deliver enough blood when your heart demanded it. Your heart was basically sending a message, I need more than you're giving me. And you felt that communication as discomfort. The term for this is stable angina. But the word stable is misleading. It doesn't mean safe, it means predictable. It means it shows up under certain conditions. It means your artery is narrowed enough to be a problem, but not completely blocked. Yet, the pattern matters more than the single episode. If this happens once, maybe it's nothing. If it happens every time you climb stairs quickly, or walk against the wind, or deal with emotional stress, and it goes away when you rest, that's a pattern. That's a signal. This one is insidious because everyone attributes it to everything else. You wake up and you're already tired. You pour coffee. You try to push through. By midday, you're exhausted, and you haven't done anything unusual. No extra work, no poor sleep. You just feel drained. Or maybe it's worse. You can do what you normally do, but it requires more effort. A walk you've taken 100 times now exhausts you. A task you used to complete with energy now leaves you depleted. And you convince yourself it's depression. It's getting older. It's stress from work. Sometimes it is those things, but sometimes it's your heart, struggling. When blood flow to your heart muscle is compromised, even partially, your body is working at a deficit. It's like trying to run a high-performance engine on low-octane fuel. It works, but barely. And that deficit creates a fatigue that doesn't match your activity level. This type of fatigue has a specific quality to it. It's not mental fog. It's not the tiredness from a bad night's sleep. It's muscular, physical. A heaviness in your body that comes from your cardiovascular system working harder than it should be to deliver oxygen everywhere your body needs it. The danger moment is when this fatigue is new. When you've been fine for years and suddenly, over weeks, you notice this shift. That's not normal aging. That's a change. And change is what matters medically. You're not running a marathon. You're not climbing a mountain. You're doing something ordinary. Walking to your car, doing dishes, sitting and having a conversation. And your breathing feels wrong. Not like you can't breathe, not like asthma, more like your lungs aren't filling the way they should. Like you need more air than you're getting. Like you have to think about breathing when normally you don't think about it at all. And it comes and goes. Sometimes it's during activity. Sometimes it's just lying in bed at night, and suddenly you're aware of your breathing in a way that makes you uncomfortable. This particular symptom can mean a lot of things. Anxiety, asthma, anemia, thyroid problems. But when it appears alongside the other warnings we're discussing, it takes on a different meaning. Here's why. When your heart isn't pumping efficiently, blood backs up. In particular, it backs up into your lungs, and when the lungs fill with fluid, they send a message. We can't move air through this. And that message arrives as shortness of breath. In medical terms, this is called dyspnea. And when it's cardiac in origin, it has a specific pattern. It often gets worse when you lie flat and better when you sit up. It might wake you from sleep. It might come on with exertion. It might appear at night when your body is at rest and blood pressure shifts, creating pressure changes in your chest. The distinction is whether it's new and whether it's changing. Shortness of breath that you've had your whole life, that's been consistent, that comes with your known asthma trigger, that's probably not cardiac. Shortness of breath that's new, that's worsening, that appears in situations where it never appeared before, that's worth investigating. This is where people get confused. They think heart attacks are about chest pain. And sometimes they are, but sometimes they're not. Sometimes your heart talks to you in a completely different language. You feel it in your left arm. Not always a sharp pain, maybe an ache, maybe a heaviness, maybe just an awareness of that arm that feels different from normal. It comes during exertion, it goes away when you rest. Or it's your jaw. You're eating or talking, and there's a soreness in your lower jaw. Not tooth pain, jaw pain, and it seems to correlate with activity. Or it's your upper back, between your shoulder blades, a tension, a knot, that gets tighter when you exert yourself. Or it's your neck, not the muscles, deeper, a feeling in the neck that something is off. These locations exist because of how your nervous system is wired. Your heart sends signals through nerves, but those same nerves also handle sensation from your arm, your jaw, your neck, your back. So when your heart is distressed, sometimes those distant locations are where you feel the message. Women especially tend to experience this. Heart attacks in women often don't announce themselves with typical chest pain. They arrive as nausea, as fatigue, as pain in the neck or jaw. And because these don't match the Hollywood image of a heart attack, they often get dismissed or misdiagnosed until it's too late. The pattern again is what matters. Pain in your arm that's isolated, that happens once, that comes from a sleeping position or a strain, that's probably not cardiac. Pain that correlates with exertion, that resolves with rest, that appears consistently, that's a pattern worth taking seriously. You're sitting quietly, you're not anxious, you're not caffeinated, and you suddenly become aware of your heartbeat. It's racing, it's pounding, it's irregular, skipping, doing something it doesn't normally do. And it lasts for seconds or minutes. Then it stops, returns to normal, and you're left with a strange awareness of your own chest. Everyone occasionally feels their heart skip a beat. That's normal. But there's a difference between occasional and pattern. And there's a difference between palpitations from stress or caffeine and palpitations from your heart trying to cope with compromised blood flow. When your heart isn't getting enough oxygen, it becomes irritable. It misfires. It tries to compensate by beating faster or harder or irregularly, and you feel that as palpitations, sometimes paired with chest discomfort, sometimes paired with dizziness or fainting, sometimes just the awareness that something is off. This is especially significant if you have other risk factors: high blood pressure, diabetes, high cholesterol, family history. Because in that context, new or worsening palpitations aren't a curiosity. They're a signal that your heart is struggling. So those are the 5. But here's what's critical to understand. Most people who experience these don't get one. They get a combination. A few weeks of unusual fatigue, then some shortness of breath, then chest discomfort during a walk. And with each symptom, they rationalize it separately. That's just stress. That's age. That's probably anxiety. But together, they tell a story. And that story has an ending. Your job is to interrupt it before the ending arrives. Here's what you actually do if any of this sounds familiar. First, understand the timeline. The research is very clear on this. When these warning symptoms start, you're not in emergency mode yet. You're in warning mode. You have a window. And that window is where intervention actually works. Don't wait. Not for the next appointment. Not for a convenient time. Not for the symptom to happen again so you can be sure. Get evaluated. Specifically, you need 3 things done. A stress test watches your heart while you exercise, usually on a treadmill. While you're running, they're measuring your heart rate, your blood pressure, your ECG. They're watching for patterns that suggest your heart isn't getting enough blood during demand. Or they do a pharmaceutical stress test, where they give you a medication that makes your heart work harder without you having to exercise, and they watch the same things. The alternative is a coronary CT angiography. This is a CT scan that looks directly at your coronary arteries. It shows whether they're narrowed, how much they're narrowed, and how much is plaque versus calcium buildup. One of these tests will answer the fundamental question: is your artery compromised enough that we need to do something about it? If the answer is yes, you're not automatically needing surgery. Sometimes medication is enough. Sometimes lifestyle changes are enough. But you're not guessing anymore. Your cholesterol matters, but not the way most people think. It's not just the number, it's the breakdown. Your LDL, your HDL, your triglycerides. It's also your blood sugar level, your kidney function, your liver function. All of these contribute to whether you're building plaque, or whether your arteries are inflaming, or whether your heart is under metabolic stress. A lipid panel tells you if your cholesterol profile is actually problematic, and the metabolic panel tells you if your blood sugar regulation is failing, because that's one of the biggest drivers of atherosclerosis. If your triglycerides are over 150, that's a sign. If your LDL is over 100, especially if you have risk factors, that's a sign. If your blood sugar fasting is over 100, or if your HbA1c is over 5.7, that's telling you that glucose metabolism is starting to fail, and that damages your arteries. You need to know these numbers. Not just that they're okay, but the actual values. Because okay, by population standards, might still be elevated enough to explain your symptoms. An EKG is a snapshot of your heart's electrical activity. It takes 10 seconds. It's not comprehensive, but it can show certain patterns that suggest previous damage or current stress. A Holter monitor is different. You wear a small device for 24 or 48 hours while you go about your normal life. It records every heartbeat. If your palpitations are real, if your heart is having rhythm disturbances, the Holter will catch them. Some people have a rhythm problem called atrial fibrillation. The upper chambers of the heart quiver chaotically instead of pumping in sync. This causes blood to pool in the heart, and pooled blood clots. And those clots travel to the brain, or to the lungs, or to the heart itself. And they cause strokes or pulmonary embolisms or heart attacks. The problem is that atrial fibrillation often comes and goes. A regular EKG might not catch it, but a Holter monitor, worn over a full day or two, usually does. And if it's found and treated, your stroke risk drops dramatically. Now here's something important. All of these tests require someone to order them, a doctor, a healthcare provider. And here's the reality. If you come in with vague fatigue, your doctor might not automatically order a stress test or a CT angiography. They might want to rule out depression first, anemia first, sleep apnea first. That's actually reasonable clinical thinking for a single symptom. But it's not reasonable if you have risk factors, and it's not reasonable if you have multiple symptoms. So you need to be the one who brings it up. You say, "I've been having exertional chest discomfort and new fatigue, and I'm concerned about my heart. I'd like to be evaluated." That phrase changes everything, because now you're not presenting with vague symptoms. You're presenting with concern about a specific organ system, and your doctor is obligated to take that seriously. Here's something else that matters. If your tests come back normal, that doesn't mean you're invincible. A normal stress test means your heart survived that particular test. It doesn't mean plaques can't rupture next week. A normal CT means your arteries looked okay the day you had the scan. It doesn't mean they can't change. What it does mean is that right now, at this moment, you're not in immediate danger, which means you have time to actually change things. Most heart attacks are preventable. That's not a slogan, that's epidemiology. Study after study shows that people who modify their diet, who exercise regularly, who control their blood pressure, who lower their cholesterol, who quit smoking, who manage their stress, who lose weight if they need to, they don't have heart attacks. Not as frequently, not as severely. Some risk factors you can't change: family history, age, genetics. But the ones you can change are substantial. And that's where the window of opportunity is. So let's talk about what actually changing things means. It's not a radical diet. It's not extreme exercise. It's not overhaul your entire life. It's small, specific changes done consistently. Your diet has two enemies for your arteries: processed seed oils and sugar, not fat. That's a myth that won't die. Your body needs fat. What damages your arteries is the inflammatory response to excess seed oil consumption and the constant spiking of blood sugar from refined carbohydrates and added sugar. If you eat real food, meat, fish, eggs, vegetables, fruit, nuts, olive oil, nuts, you're already doing better than most people. You don't need to be perfect, you need to be consistent. Exercise doesn't have to be intense. Walking for 30 minutes 4 times a week reduces cardiovascular risk by 30%. That's significant, that's worth doing. Blood pressure. If you have high blood pressure, treating it is non-negotiable. But treatment doesn't always mean medication. Sometimes it means reducing salt intake, reducing stress, exercising, and losing weight. Those 3 things together can drop blood pressure more than people realize. Sleep. Most people are sleep deprived and don't realize it. Your heart is recovering when you sleep. When you're sleep deprived, your heart is never fully recovered. Chronic sleep deprivation drives atherosclerosis. Get 7 to 9 hours, consistently. Stress. This is harder to measure, but the effect is real. Chronic, unmanaged stress causes inflammation. It raises cortisol. It raises blood pressure. Managing it, however you do that, meditation, exercise, time in nature, therapy, reducing sources of stress, directly improves cardiovascular health. Smoking. If you smoke, everything else you do is partially negated. Smoking is the one variable that alone can cause heart attacks in people with no other risk factors. If this applies to you, quitting is more important than anything else. Here's the final part. If you've experienced any of these 5 warnings, or if you have risk factors, don't wait for a better time. There is no better time. The decision you make about this in the next few days might literally be the difference between a life where you have agency over your health and a life where health events happen to you unexpectedly. Most people who survive heart attacks and look back say the same thing. I knew something was wrong. I just didn't act on it. Don't be that person. Your body is trying to talk to you. It's been trying. Listen, get evaluated, know your numbers, and if changes are needed, make them now, while you still can, while you're still in the window where prevention actually works. Stroke isn't random. Heart attacks aren't random. They announce themselves, and in the vast majority of cases, they can be stopped. If this applies to you, if any of these 5 warnings sound familiar, share this. Send it to someone you know who needs to hear it. Tell someone what you felt, even if it already passed. And get evaluated. Your heart has been trying to get your attention. Now you know what it was saying.